Hello YouTube and welcome to my channel, Upright with Dr. Polley. I am Dr. Amber Polley and I am a Christian GP in South Africa living with chronic illness. In my last video I spoke about my symptoms of chronic illness and living with POTS, and today I want to share with you how I got to my diagnosis. The road was long, messy, and really emotional, and very delayed. So there were some very early cues that I didn't actually attribute to being necessarily anything deeper than what it looked like on the surface. I have had exercise intolerance from childhood, so I was misdiagnosed with asthma as a child. Just really struggled to keep up with fitness in comparison to my peers. My fatigue began in final year medical school, and at the time I didn't really think much of it because everyone was tired. This is a common thing with things like POTS or chronic fatigue or other neurological conditions or any chronic condition, is that you compare yourself to others. You chalk your symptoms up to being normal. But what I learned is that someone else's fatigue was not the same as my fatigue. Their fatigue wasn't debilitating. It wasn't limiting their life. And I think that's something for many of us. We are like, well, everyone's tired. And so you don't actually look further. But everyone's not you're tired. After medical school, started internship, fatigue persisted, and I developed quite severe burnout towards the end of the first year. Was seeing a therapist and needed to take a few days off work. This for me was a big blow because I've always been a very resilient person. I've always been someone who will push myself to the limits. Needing to take those 3 days off work really was super hard for me because I'd never needed to do that in the past. None of my colleagues were needing to do that, and so there was kind of that sense of failure. Through internship, I started becoming more and more fatigued, but still kind of chalk this up to this is just normal internship. Like, I am doing 30-hour shifts sometimes, and most of the time it was about 28-hour shifts, which is quite normal for South African doctors. But again, like, my colleagues were saying they were tired, but it's like they could still go to gym on a post-call day or see friends on a post-call day. I would sleep for 20 hours. The longest sleep I had post-call was 26 hours. I had to scale down on friendships. I had to step back from serving in church. I had to, there were so many aspects of my life that it affected. And looking back, like, those were probably signs of something more physical, but they were labeled as psychological by myself. I was gaslit by myself. On average, the time from symptom onset to diagnosis is about 5 years. Because it's understudied, it's not known by providers. It's starting to become more known now. There's so many reasons for a delay in diagnoses. Starting with my diagnostic journey in about third year medical school, so this would have been 2014, 2015, I consulted a pulmonologist about the exercise-induced asthma that I'd been diagnosed with since I was like 10. He did a variety of tests. He told me it's not asthma, it's actually vocal cord dysfunction. You're getting paralysis or spasming of your vocal cord when you exercise. This made a lot of sense. I consulted him because I was trying to exercise and I couldn't. And I would get so upset with my body because I would go to the gym like 4 or 5 times a week and do other exercise and still not be able to run a kilometer without needing to walk. I kept starting like couch to 5Ks, and my friends who would start it with me would be like running and I would be like dying. This asthma pump that I had was not working, which makes sense because it wasn't asthma. He diagnosed me with this vocal cord dysfunction. It essentially is that where your vocal cords, when you exercise, are meant to open nicely when you breathe. I can't make the shape right now. But anyways, mine is like spasming. And so I was breathing through this tiny little hole and trying to keep up with my peers. And they were breathing through this hole. But anyway, so at that time, I also mentioned to him my orthostatic intolerance and how I frequently got dizzy when I stood up. When I exercised, I would get really lightheaded sometimes and need to lie down. So he did a test where he tested my blood pressure lying down, standing up, and he was like, there's no change, so it's not orthostatic hypotension. You're just going to have to deal with it, exercise more. I don't think he knew about POTS at that time. I mean, this was 2013, 2014. And so I think medical knowledge gaps, even amongst specialists, can prolong our diagnosis. Kind of moving along, in 2020, I moved to another town in South Africa. It was a rural town. It was about 16 hours from my family. In March of that year, I experienced quite a traumatic break-in where I was alone at home, 3 men with guns, not fun, miraculously saved by Jesus. Story for another time. The break-in happened on the Friday night. Our president announced lockdown on the Sunday night, and I had to find a new place to live and move before the Thursday, which was when lockdown was starting. So now we had this whole new condition that we needed to learn how to treat. Management at the hospital, no one really wanted anything to do with this COVID thing. Myself and the 2 other comserves initiated and ran COVID ward. This was quite traumatic in itself because we were now treating patients with this new illness, and patients were dying and we couldn't do anything about it. At the time, to be able to refer a patient to a center that had a specialist or an ICU, we needed a COVID test result. Our COVID tests were taking like between 10 and 20 days to come out. And by that time, the patients were dying. Like, they did not survive to that time. We needed to manage those patients. It was quite traumatic as well. So there was compounded trauma in that year. A month in, we scaled down from level 5 to level 4. I got a permit from the police and was able to travel back home. So I drove 16 hours on my own in a day to get back home. Just spent the next 2, I think it ended up being 3 weeks recovering, having a lot of trauma counseling, prayer, and really just trying to process the break-in. So I developed quite significant PTSD symptoms, and basically like my body just went into full-blown fight or flight mode, needing to go back to work and now still do after hours shifts, still manage COVID ward. I think that was the beginning of the deterioration of my parts. I think at that time there was an injury to my vagus nerve, my nervous system. I believe that that trauma provoked some epigenetic changes. So then after community service, I moved to a new town, which is where I live now. I really felt strongly this is where God wants me, and I still feel that, like, I know that this is where God wants me, but it wasn't an easy move. It was actually really difficult. I needed a time where I could be feeling really safe, to allow my nervous system to recover, and I kind of just hit the ground running and kind of wanted to be as involved as possible, and I didn't allow that for my own body. I then started a new GP practice. After never being in private practice, I started it with a friend of mine, so that was big. And then a year later she had to move with her husband, and so I was left running this practice on my own, battling with fatigue, still at that time having some PTSD symptoms. In that year, the fatigue was still quite bad, and I needed to downscale on what I was doing. After a weekend, I would start the week like with quite a decent amount of energy, be like, I'm going to ride this and this day in the week, and I'm going to do this social and this thing for church, and like had a plan, and I was always really busy because I love being busy. My body just started saying no. I didn't want to listen. Eventually, there would come times where I literally just couldn't work. My brain would like malfunction. I would get a really bad migraine. What I know now were migraines. At the time, I was like, it's a headache, and I was like, it's a headache. And my receptionist at the time would like come in to my room and see me, and she would be like, Amber, go home. I'm going to cancel your patients for the afternoon because you can't see patients like this. And I'm like, oh, but I need to. The pattern was that like on a Thursday, I would crash hard. I would get this like really bad migraine and need to go home. In the beginning of 2023, I started to develop quite significant depressive symptoms. So very low mood. I was crying a lot. I had very negative self-talk. I had tried for the last like 2 months to CBT myself. I was like, I'm gonna make myself think better. I tried. I did all the things. I prayed a lot. I worshipped a lot. I exercised more. Because these are the things that's going to make my depression better. Eventually I realized I need help. Made an appointment with a brilliant psychiatrist, and we had done all the blood tests. Blood tests were clear. It looked like there wasn't anything physical going on that we knew to look for. And started on an antidepressant, and like within, I would say, a week, the depressive symptoms all cleared up, but the fatigue persisted. So we were like, maybe it's because the anxiety isn't controlled enough, or and I was like, I'm really not feeling anxious. Like, I don't feel anxious, I just feel tired. I'm not making it through a day. We decided to try a different class of medications, and anyone who knows about like antidepressant medications, our first two lines is usually something called an SSRI, and then you've got an SNRI. At that point, we decided, well, let's try something a bit more activating. Let's try an SNRI to see if it gives you a bit more energy. And I was like, yeah. So we started it. Again, the depressive symptoms were controlled, but I actually developed more fatigue. And when I would go for runs, it felt like my muscles were super weak, and I just actually couldn't run as much as I normally could. And then I started noticing a resting tachycardia coming up on my watch. One morning I got to work and my heart rate was like 120, and I even did an ECG on myself, and I was like, why is my heart rate 120 lying down? So then we realized, okay, I'm obviously very sensitive to the noradrenergic side effects. So we settled on staying on an SSRI, and yeah, depression completely in remission, but the fatigue persisted. Going into that December, I remember saying to my parents, like, I need a break, like a solid break. And previously, when I'd taken like a solid 2-week break, by the second week, I would feel a lot better. So I was like, I need a 3-week break. We're going to the farm and I'm going to be doing nothing. Went to the farm, was super fatigued most days, didn't find the same recovery after a week, even 2 weeks, was still really fatigued. While I was at the farm, I went to go fetch something for my parents from the kitchen. And when I got back, I checked my watch and it was showing that my heart rate was quite high. I was like, that's weird. Hey, mom and dad, look, my heart rate's 115 and I'm just standing here. And they're like, that seems high. And I'm like, well, I don't feel any different from what I normally feel. Like, and they were like, you need to see a cardiologist. And I was like, that seems extreme. Like, it's probably nothing. Like, it's maybe just, I don't know, something I ate. I don't know. So you know how most of you, like patients, these are patients that I'm speaking to now, would have experienced some form of medical gaslighting along the way, bringing up a symptom and getting told, it's probably anxiety, or it's probably, I don't know, what, fill in the blank. So I gaslit myself a lot in this process. Some other cues that I had leading up to the diagnosis was, one, that my watch started notifying me that I was stressed a lot. It would say, your stress levels are unusually high. You should take some deep breaths. And I'm like, I don't feel stressed, like, at all. Like, it would be like if I was examining a patient's chest and I'm like, they have the flu. There's like nothing for me to be stressed about. Like, I'm literally just listening to their chest. I was like, maybe I am just really angry. I don't realize it. Then looking back, I was like, oh, it was picking up that the increase in heart rate when I stood up being interpreted as stress. So that. And then the other cue was that a patient came in about August of 2023. And they were like, I think I have POTS. And I was like, POTS is TB of the spine. I don't think you have POTS. And then she's like, no, these are the symptoms that I get. I've been reading about it and it really fits with my symptoms. And then I vaguely remembered this one slide from like 4th year medical school about postural orthostatic tachycardia syndrome. And I was like, oh, you're talking about that POTS. And I started doing research for her on POTS so that I could manage her better. Didn't think about it much again. In January of 2024, I developed tick bite fever. I completed treatment, but I noticed a significant deterioration in symptoms after having tick bite fever. So, sorry, my dogs. My fatigue worsened, my brain fog worsened, my physical symptoms worsened. I was getting a lot more nausea. I got more headaches / migraines. After seeing this patient again in around February, March, I can't remember exactly where, I realized that all of those symptoms lined up with my symptoms. And now, kind of in the back of my mind, having the strange heart rate when I was on holiday, I realized this could be POTS. And so I did what's known as a poor man's tilt table test on myself. I definitely met the criteria. So a poor man's tilt table test. So you lie down for 10 minutes, you measure your resting heart rate and your resting blood pressure. And mine was around 65, 70. And then you stand up and you measure your heart rate and your blood pressure for 10 minutes. My heart rate went up to about 120 standing and my blood pressure didn't drop. And so I was like, oh, it's a positive test. Your heart rate needs to go up by 30 beats per minute at least and stay up. If it normalizes again after 5 or so minutes, then it's not POTS. Could be something else, but it's not POTS. And so mine increased by about 50 beats per minute and it stays there. I was like, it looks like I have POTS. Booked an appointment with a cardiologist, saw the cardiologist in May 2024. He did all the tests that needed to be done. Not a proper tilt table test though, because those aren't really available easily in South Africa. Echo and stress ECG and examinations. The echo came back normal except for a very small mitral regurg, and the stress ECG came back normal. And so he was like, yep, you have POTS. This sucks a lot. He used different words that I'm not going to repeat on YouTube. Yeah, I think that diagnosis, as sucky as it is, I felt relieved. I felt validated because all the symptoms that I'd had, it wasn't just in my head. It wasn't because I'm not good enough or I'm lazy or I'm not just burnt out. I'm not just weak. There was an actual disorder in my body that was causing these things. Over the last year, there's been a lot of grief as well. Grief over what my life could have looked like. I absolutely love surgery as a discipline. There was a point where I really wanted to specialize in surgery, and unless I get healed or get better, I won't actually be able to do even assistant surgery because I can't stand up for more than like 5-10 minutes. The take-home message is that POTS diagnoses are often very delayed. If you're a patient and you've experienced this in medical care, just know these diagnostic delays are normal. Should doctors pick it up earlier? Definitely. I think that there is that change happening. People are becoming a lot more aware of POTS and how it's affecting people, especially after COVID, where a lot of people develop post-COVID POTS. If this sounds like your story or similar in any way, keep asking questions, track your symptoms, and advocate for yourself in getting these type of tests done. I just want you to know that you're not alone. There is definitely help available. You just need to find the right help. If you like this video, please hit the like button down below. If you want to be notified of my next video, which is going to be my treatment journey and how I manage my life with POTS, hit the subscribe button. And if you made it to the end of this video, leave a comment below, something to show me that you made it to the end of the video. And you want to leave your story, leave questions, tell me what topics you want me to discuss in the future, leave it down below. Bye.